Welcome to our first video podcast episode of Child Mental Health for Pediatric Clinicians. I'm your host, Dr. Elise Faluco, child psychiatrist and mom. Today's episode is about cannabis and the teen brain. And I have to tell you, I was talking about this with our two older kids who are both teenagers. And one of them was like, "Mom, stop talking about cannabis. This is so embarrassing." So the goal of today's episode is to share with you the latest research about the association between cannabis and mental health problems in the developing brain. So here we go. Let's start out by a brief refresher. So what do we know about cannabis? Cannabis contains a lot of different compounds, but the ones that we're most interested in would be delta-9 tetrahydrocannabinol, also known as THC, which is the main psychoactive compound. It interacts with our endogenous cannabinoid receptors naturally occurring in our brain, which are associated with learning, memory, motivation, etc. And THC is the compound that gives you that high, that sense of euphoria or relaxation. But it also it can impair your working memory, it can stimulate your appetite, and can increase anxiety and psychotic-like experiences while you're intoxicated. All right, so that's the THC part. There's also CBD, and CBD stands for cannabidiol, and CBD is associated acutely with some therapeutic effects, like maybe decreasing anxiety or causing a little bit of drowsiness. The important thing to know, though, is that most cannabis that's found is really high in THC, the psychoactive part, and pretty low in CBD. Today's cannabis is much more potent than it was even back in the 1990s. And I'm going to ask you a quiz question. So how much more potent is cannabis than it was back in the 1990s? Is it option A, is it twice as potent? Option B, is it 3 times as potent? Or is it option C, almost 4 times as potent as it was back in the 90s? I'll give you a chance to guess. But the correct answer is C. Today's cannabis is almost 4 times as potent as it was back in the 90s. Okay, so now that we've done a brief refresher on what cannabis is and why we should care, let's talk about what we know about how common illegal use of cannabis is among adolescents. So our most recent data comes from 2024 in the US. And what we know is that while recreational use of cannabis is illegal in adolescents under 21 years of age, about 1 in 4 high school seniors report that they've been using marijuana in the past year. So while we all would like to believe, not our kids, the data would suggest that there are a lot of kids and teens particularly that are using cannabis. And the majority who are using cannabis are doing so via vaping. We've talked about how cannabis contains THC and CBD. And we've talked about how while recreational use of cannabis is illegal, it's actually surprisingly more common than you would think among teenagers in the US. So now here's where we get to the 3 things you need to know about how cannabis affects your brain and your risk for mental health problems. Thing number 1, let's talk about cannabis and the teen brain. Now, I'm really tempted to go into a lot of details here, but I'm going to try to control myself. So, of course, all of us know that the teen brain is still developing, and in particular, the front part of the brain, the prefrontal cortex, which is responsible for executive functioning and planning and decision-making. This area of the brain is also highly concentrated with our own endogenous cannabinoid receptors. And so when you're vaping marijuana or smoking weed, that chemical is getting in and interacting with these receptors in the prefrontal cortex of our brain. And we have a really beautifully elegant study that was published in JAMA Psychiatry back in 2021 that talked about how cannabis use during adolescence is associated with changes in this area of your brain. They followed kids starting at age 14 over the next 5 years, and what they found is that there was altered brain development in the area of the prefrontal cortex among those kids who were using cannabis compared to those who were not. This was the largest long-term longitudinal neuroimaging study of adolescents using cannabis to date. And these findings are concerning because essentially what it's saying is during this critical period of brain development, i.e. adolescence, that using cannabis impairs the area of your brain responsible for planning, for organization, for higher order executive functioning. And these are really important skills and not ones that we want to be affected. So the first thing that we know about cannabis use is that it can impair the development of your prefrontal cortex. Not good. The second thing to know about cannabis is how it increases your risk for certain mental health problems. There was a recent really big systematic review and meta-analysis of cannabis use and anxiety among adolescents that was published in 2024. And what they found is that compared to teens who were not using cannabis at all, those teens who did use cannabis were more than twice as likely over the next coming years to develop a subsequent anxiety disorder. Eek. This is confusing because how many of us have had patients that say the reason why they smoke or vape cannabis or weed is to relieve anxiety? And let's go back to what we talked about, the basics, that THC, the psychoactive component in cannabis, actually is anxiogenic, meaning it increases anxiety. So while teens may feel like somehow this euphoria, this high, this escape is helping them get away from their anxiety, ongoing use of cannabis increases your brain's propensity for development of anxiety. That is not good. Okay, finally, the third thing you need to know about cannabis, the brain, and mental health has to do with the association between cannabis and psychosis. We talked about before that acute intoxication with the THC part of cannabis causes psychotic-like symptoms, or at least can cause that. But the data is a little bit more complicated when we're talking about long-term psychosis. We have epidemiologic evidence that there is an association between cannabis use in adolescents and an increased risk of later developing a chronic psychotic disorder. So I would particularly be worried about people who have a strong family history of psychotic disorders, bipolar, schizophrenia, major depression with psychosis, any sort of very severe mental health disorder. Those people, we should tell them that they are essentially allergic to cannabis, because those who are already at high risk for developing psychosis may easily be tipped over the edge by using cannabis. All right, finally, what do we do with this information? A couple of ideas. It is important for us to share what we know from science and research about what teens can do to reduce their risk. Of course, you want to encourage abstinence because we have pretty good evidence to suggest that using cannabis increases your risk for developing an anxiety disorder. And we do have pretty strong evidence to suggest that cannabis use during adolescence, when our brain is developing, negatively impacts the development of our prefrontal cortex, which is really important for executive functioning, higher level thinking, etc. If you're working with a teen or family that you think is not about to completely abstain from using, we need to think about harm reduction, which is really starting by getting them to reduce the frequency of their use. Also warning them that they really should try to limit or avoid any cannabis products where the concentration and the potency is really not known. So specifically edibles. They're infused oral products where there's really no clear regulation and no evidence of what type of concentration of THC they're going to get, because we know the greater concentration of THC, the greater risk of developing some of these bad consequences. All right, this is the end of thoughts and tips about cannabis, the teen brain, and mental health. Please share a comment in the chat or check us out on our website, psyched4peds.com. Subscribe to our YouTube channel, and we will see you next time on Child Mental Health for Pediatric Clinicians.